Welcome everyone. Today we are going to have a virtual discussion about choosing a health career that could be right for you. What we've put together is a panel of 3 different individuals in 3 different careers within the health industry. We have a nurse, a therapist, and a dentist with us today. And so obviously there are a lot more options within the health industry than those 3, but those are really good places to start to get an understanding of the differences between these types of careers and some others. So Elisa, do you mind turning your camera off? Thank you so much. So we have a live class with us today, and we're hoping to have some questions either through or through both the live class with us, as well as we are streaming live on YouTube. And so I'm going to say to the class, please, as we go through this, we have some moderated questions that we're going to ask, but I assume that you're going to have your own questions as well. So feel free to utilize the chat to either ask that question, and I will try to integrate it into our moderated questions. Or if you want to just unmute yourself and ask it yourself, that would be even better. And all you have to do is in the chat, just say, I have a question, and I'll call on you when we get to that point. We have a few people watching on YouTube as well. So I'd say for the YouTube people, utilize the chat function to ask a question, and I'll do the same thing. I'll try to weave it into our questions. We do only have 40 minutes today, so we might not be able to get to all the questions. So just a warning. Before we kick it off, though, I do need to introduce our panelists. So who we have here is we have Mary Kay Brooks. Mary Kay, do you want to introduce yourself with your job and where you work?
Absolutely. I'm Mary Kay Brooks. I'm a nurse, and I'm currently the director for risk and infection prevention at Kaiser Permanente for Marin Sonoma, so Santa Rosa and San Rafael.
Very cool. Emily Larkin, do you mind introducing yourself?
Yeah, my name is Emily Larkin. I'm a licensed marriage and family therapist. I have a private practice business that runs out of Sebastopol and virtually now, of course, with the pandemic. And then I also work part-time at a school in Petaluma providing mental health services.
And Amy.
My name is Dr. Amy Munsell, and I am a general dentist up in Healdsburg. I have my own practice here, just single provider, and have been here for about 5 years now at this practice. So
wonderful. Yeah. So to start it off, I'm actually going to go right back to you, Dr. Munsell.
Yep.
Do you mind just kind of giving an overview of what you do in your career every day, and then also what is it that you love about what you do?
Yeah, so I'm a general dentist. So dentistry has many different professions within that umbrella. There's dentists, there's dental hygienists who do like the teeth cleanings, there's dental assistants who help and support the dentists. There's orthodontists. Most of you guys are in high school, so probably have had some experience with orthodontist or know somebody that's had braces. There's lots of different fields within dentistry, but as a general dentist, I kind of do a little bit of everything. So I can do a little bit of everything that you would have done in a dental office. But why I kind of chose that route out of school is because I enjoy the variability and the variety. And I get an opportunity to see little kids, for their very first dental visit, all the way up until I have a patient that's 102. So I kind of get to see everybody and all their families and everything throughout their life. And it's that part is really interesting and rewarding because each age brings different challenges. And so it keeps me on my toes.
You really have I was just gonna say, really have a patient that's 102 years old, huh?
I do, yeah.
Wow, that's
yeah. She's awesome, going strong, has all her teeth, so it's pretty amazing. I said, I'm gonna make you my poster child. Yeah. So, and I think that's just kind of what has drawn me to, general dentistry, and also the fact that you can, some facets of dentistry, you maybe only see them once and then, they're onto something else. But I enjoy building relationships with people. Sorry. And yeah, so that's part of what, is really rewarding. It's getting to kind of build relationships, see the whole family. I saw a patient today that was 3.5, and I remember when he was in his mom's tummy. So it's kind of fun just to like see the whole scope. So, and I will turn this phone off. Sorry, guys.
Thank you. In the meantime, Emily, do you mind talking about your career and what you do, and as well as what you love about it?
Sure. So like I said, I'm a licensed marriage and family therapist. I work with individuals, families, couples, kind of the range. I mostly focus on individuals in my work. So even though my license is a marriage and family therapist, a marriage and family therapist can kind of work with the breadth, like anybody. I support people in, working through relationship issues, mental health issues, like often anxiety and depression, or more severe issues, and even just helping people, come to some more insights about, how they function in the world, why they have difficulties in certain areas, where those things stem from. To kind of help themselves maybe lead a little bit more of a fulfilled and aware life, and that's kind of why I really like what I do. That kind of leads into that. I really enjoy getting to see people just kind of have those really amazing aha moments and understanding, oh, that's why I've had such a hard time with this issue most of my life. It makes so much sense. I get it now. Like someone gets me, I get me. And that really helps me, and them, be connected and feel like someone else is kind of with them in that muck. And that's actually, I really, maybe I'm an outlier from many, but I really enjoy kind of sitting with people in the struggle. There's something just really human about it. And there's, to me, nothing better than those moments of just really getting to be with somebody and share in their experience and support them in coming to a new place.
Thank you, Emily. Mary Kay, do you mind explaining what you do on a daily basis and what you love about your career?
Yeah, absolutely. So what I do on a daily basis is kind of a little bit of detective work, I guess I would say. Hospitals and healthcare is very complex, and it's important that if we make a mistake, or if somebody gets an infection, or somebody's care isn't to their level of satisfaction, we need to drill down and figure out what we can do better. And so that's really what I do on a day-to-day basis. It could be a patient safety concern. It could be an infection prevention concern. It could be when patients leave the hospital, they get satisfaction surveys. And so there could be times where they leave comments very specifically about things they didn't like when they were there, and also things they do like, which we want to do more of those and less of the others. But it's really my job to make sure that we investigate those and try to provide the best care possible for the patients that are in the hospital. What I love about nursing is just how diverse it is. When I graduated 30 years ago, I started off as a burn unit nurse, did that for many years, and then started to move over into quality and patient safety. And then I've been in this role pretty much for about 20 years in one capacity or another. And like I said, even though I'm not taking care of patients directly anymore, I feel that my work is so important to their care because it's putting things in place to keep them safe and to make sure we treat them, based on the evidence and as safe and high quality as possible.
Thank you. So I want to get into some of the rest of the Q&A, and I have a handful of questions, but I want to remind the students that now is a great time to start with any of the questions that you might have. Put them in the chat and we will ask them of the panelists. And if you have a question of a specific panelist, based on their job, then please specify that in your question as well. But since we have none right now, I'm going to ask the question about what is it that sparked your interest in pursuing this career? Emily, I'm hoping that we can start with you on this one.
Yeah, great. So I would say my interest peaked in mental health and psychology early on, before I even knew what that was. I found myself just really enjoying hearing people's stories, being able to just kind of understand their perspective and empathize with them and support them in figuring out like what to do about situations. That was kind of where it started at a young age. And then I didn't know this was an option for a career field until I got much older. Therapy wasn't a career field like a teacher, doctor, lawyer that we all hear about when we're young. And it wasn't until I took my first psychology class when I got to the end of high school and then beginning of junior college, where I started, that I really took psychology courses and began to actually say to myself, oh, this really interests me. There's something about this that makes me want to go further. And so that was kind of the beginning of my path, I'd say.
Great. Thank you so much. Mary Kay, I'm going to throw it back to you. What sparked your interest in becoming, well, it sounds like you were a
nurse.
You're a nurse.
Yep.
You also have, let me actually ask you this separate question.
Okay.
I see on your name, you have RN, which registered nurse, MSN, CPHQ, CCDS. What do all those mean? First of all, that's what I first want to ask.
So the MSN is, I have a master's in nursing, and I'm actually working on my doctorate right now. So that's kind of the beauty of nursing. You can just keep learning. And then the CPHQ is, I'm a certified professional in healthcare quality, and the CCDS is, I'm a certified clinical documentation specialist. So really looking at the level of the documentation from the doctors and nurses to make sure that we accurately reflect what's happening, and then we get billed appropriately.
Okay. But it all started with
nursing.
First step in nursing. So what drove your interest in going into nursing?
So actually, at a very young age, when I was 14, my dad had a stroke, actually. And it was, I was very close with him, and it was very profound to me, had a big impact on me and my mom and family. When you're dealing with, a health crisis in your family, it's really hard to get support, especially when you're a teenager. I would call my friends, but they didn't really know what to say. And the nurse that took care of my dad all the time was amazing. And she would always single me out to see how I was, to see if I had questions, would hold my hand if I was crying, and just was, just made such a huge impact on me. I thought, this is what I want to do. I want to be able to help people that aren't in a position to help themselves until they're able to. And so that's really how I decided to become a nurse. And that's what I decided to go to school for after I graduated from high school.
Great, thank you. Dr. Mattel, you mind telling us what sparked your interest becoming a dentist?
Yeah, definitely. So I would kind of trace it back to like pretty young, probably high school or before. Just my uncle was a dentist down in the Bay Area, and we lived, about an hour and a half away. And so my whole family of 5 would hop in the car and we'd drive up to his office. And so because everyone was going to get seen that day, we spent a lot of time sitting there and waiting, and he'd often like put us to work and file. And one thing that I distinctly remember is that he would let us mix putty and impression materials, and there's all these kind of fun things that were like Play-Doh and clay and sculpting. And I've been crafty my whole life, and I really enjoy working with my hands. So that to me, I was like, oh, this is kind of cool. Like we get to work with all these interesting materials. And then obviously the older I got and the more into it, and even in, applying to dental school, one of the interesting things, because my background was actually in like sports medicine, physical therapy, that type of work, but one of the things that they really wanted when you were applying to dental school was sculpture classes, jewelry making, all of those things, which are so, you would never think that, but there's a lot of what we do is so detail oriented, and we work with a lot of different metals, and we work with a lot of different, putty clay type things. And so, and we basically sculpt teeth all day long. That's what we do. So, in an effort to make people healthier. So it kind of was that good balance between, the crafty, hands-on kind of engineering side, and also like healthcare, people relations and all that. So my uncle's still my mentor today. He's just on the tail end of his career and retiring, but I still call him all the time with questions and things like that. So yeah, out of my 25 cousins on that side, I was the only one that took his bait, that he dangled in front of all of us for a lot of years. Don't you want to be a dentist? And so, but I couldn't be happier with that decision. So he also guided me early on when I was applying to dental schools, there, and we could probably talk about this later too, but it's very expensive to get into dental school. The schools are not cheap at that level. So he kind of opened my eyes to some other options. And I actually went into the Navy and had the military helped me fund my dental school education. So I'm always grateful to him for that too, because it was such an amazing experience. So
I think it's so interesting that that perspective of almost kind of being the crafty side of dentistry.
Yep.
It's something that I never would have thought about.
Yeah, it's not all just, gross spit in people's mouths. It's yeah, there's more within that, I promise. Yeah.
Mary Kay, we have a great question from Madison in the chat, and she's asking, so I have a question for Mary. I am personally interested in becoming a nurse. I'm currently interested in either a pediatric nurse, geriatric nurse, or an RN. What advice would you have when it comes to where to start?
Well, that is a great question. And as I mentioned, one of the great things about nursing is there's so many different avenues that you can take. And so whether you get a chance to volunteer or when you get into nursing school, you'll do clinical rotations. And so one of the things I definitely recommend is try to pick as many different areas as you can, because you'll figure out what is a good niche for you. Like I said, I was a burn unit nurse for many years. And when I tell people that, they're like, oh, that's horrible. How could you be a burn unit nurse? And I think to myself, well, how could you be a psych nurse? That would be so stressful. So again, you pick what is a good fit for you. And if you love kids, pediatric nursing. Some people love taking care of elderly adults. Some people love psych nursing, emergency nursing. It's just getting that exposure and figuring out what feels good to you, and then what the environments are. If you're taking care of kids, you also have to be able to handle the parents and extended family. So and some people, like I have friends that are OR nurses, they like their patients asleep. So again, you have an opportunity to pick what works for you and where you think you'll be able to make the biggest difference. But it's really getting the exposure is the key.
Can I add something to that too?
Yeah.
I think sometimes too, instead of like picking a career, you kind of have to think about what you're really good at, or your strengths, and what interests you. And that can sometimes help shape what type of, so if you know that you aren't great with kids, or you don't want to be, then pediatrics is not your thing. But I think sometimes looking just in general at some of your strengths, or some of your, like in my case, crafts or things like that, some of your hobbies, and that can kind of help shape, what direction you might want to go to.
Yeah, and thank you for saying that, because I was actually going to ask both you and Emily to maybe also give that piece of advice in the industry, and you kind of just did. But do you have any other piece specifically around dentistry about where to start? I mean, you mentioned that you went into the military, right, or Navy?
Yes, yeah. So I went into the military after college, or after dental school. So that was a great place to get experience, like clinical experience. But I was brought into the military as a dentist. So that part was already decided, long before that. But I think things like what we're doing right now, getting exposure from people in the field. And I can't help but notice that there's like 3 women on the panel, which in dentistry, that was not always the way. It was definitely a male dominated profession for many years. So I think that's always kind of, seeing the real people and talking with them and getting experiences, and then shadowing. So I know a lot of high school programs will do job shadowing things. And I think that, until you can see a day to day, I think that is worth so much. So I would encourage, anybody, if they have opportunities in any profession, would be to, make a relationship with somebody, go out into your community, seek somebody out that could become a mentor, for many years. Like I said, mine happened to be family, but I've had a lot of mentors throughout my career in different areas that I can still, call upon, even though we're now colleagues. So I think if you can get somebody that you trust or that you are interested in the field and try and do some shadowing, I think that's the best.
Emily, what about you? What do you have a piece of advice for where to start to get into a mental health career?
Yeah, one thing I didn't mention earlier when I was talking about my path to kind of getting to my career field is my first actual experience with what therapy might be like, and what it might be like to actually hold this position and be in this role was once I had kind of found psychology was where I wanted to start. And then I, along the way, took a counseling techniques class at my college. And that was my first experience of really seeing therapy in the room, so to speak. I hadn't been to therapy prior to that personally at that point. And so that was kind of the beginning of me going, oh, wow, this is what it's like to sit with somebody. This is what it's like to ask those questions and sit with the vulnerability in this kind of professional capacity. So I think, again, it's really kind of like what Amy and Mary said, finding your general interests and then kind of following the path and just trying things out, seeing what skills you might already have that kind of lead you toward those interests. So I kind of say just try things out, follow what you're good at, follow what you're interested in, and with that, I'm trying to remember what I was saying. With that, I actually really encourage people, if I feel like therapy, being a therapist isn't just about what's going on for other people. It's also about being introspective of what's going on for us. And I think some of the best learning can come from your own personal work in therapy. So, kind of figuring out how you tick. And that's also a great way to kind of pick up and feel what it's like to be in a therapeutic relationship with a therapist. So I've learned a lot from my own experience personally in therapy about how to be the kind of therapist I want to be, and what it looks like to actually do that work and not just be the person who's a friend who listens, because it's very different to do that.
Emily, we have a question that came through on the chat from Jackie, and it's for you. So I'm just gonna ask that now, and we'll stick with you for a second. Recently, there have been reports that there is a strong need for mental health in regards to youth. What do you think school administrators can do to support the mental health needs of youth in school?
Great question.
It's a
Very
really good
great question. As I mentioned, I work part-time in a school, and there is such a need. So mental health, I think it's just now kind of up and coming, becoming more of a focus in schools. A lot of schools in our area, we're really lucky that mental health has been seen as somewhat of a priority, at least more than it used to be. So a lot of schools will employ people like myself to be available to students for mental health support. And that's a little different from, say, your academic counselor who helps with, what classes you're taking, or, little things like that aren't so little. And they do help with some mental health support, but then to have people who have a focus on mental health being present on campus or at school, or available for peer relationship issues, anxiety that comes up, depression that comes up, other mental health struggles. I think that is kind of the most important thing that schools can really focus on, is allocating resources and funds to make that possible, so that schools can employ more mental health professionals. Especially right now, I think it is so needed. And I think people are really noticing that more and more and opening up to that. And then I think it's a matter of, where's the funding going to come from? So I think that that's always a struggle in the school system and in a lot of systems, but I think it's very clear to see that that's really needed, especially with this last year that we've had. And so, figuring out where to, in a sense, put the backing behind where the need is, I think is just a struggle kind of at the top that we're working on, more and more.
Emily, you had mentioned the importance of mental health for youth in this past year, and I think you're totally right. But I'd also say in Sonoma County, with all of the recent fires, for example, there's been a lot of school mists. There's been a lot of, people who have lost homes, families who've had to move. There's a lot, I think, especially in our area, more than I would say most areas within the US. I mean, we just are kind of in this pocket where we've had a handful of disasters, and those do impact the mental health, especially of the youth. So I think you're totally right. And it's super important right now. And that's a great question, Jackie. Thank you very much. I want to move on.
Thing before we move on, sorry. Yeah. With that, mental health impacts health, our physical health, how we function in school, how we can do well on our career path. So, if our mental health is not being taken care of, then we're not healthy. And so, anyone who's looking at going into these fields that go into doctorate level, like Amy and like Mary's working on, that requires a lot of energy, and we have to be able to kind of be okay to be able to sustain that and not burn out. So again, it's just so important.
Yeah, thank you. I want to turn the conversation a bit to the interests and skills that someone should have in order to get into some of these careers. And I'm going to start with you, Dr. Mansell. What kind of interests and skills should a student either have, or maybe if we're talking about skills, be interested in learning if they really want to pursue a career in dentistry?
Sure. So we are, just like everyone else on this panel, are health focused. So having an interest in, making things better, being healthy, education, is really important. So we, like I said before, there's like the technical skills, there's also the people skills. So I think if you are somebody that is, can multitask, that's a big one. Patience is a big one. But yeah, that likes to work with their hands and is, likes the science. I know you guys did a lot of anatomy and physiology stuff earlier this year. That's a huge part of what we do is, a dentist is just a doctor of this area versus like a podiatrist for your feet, or, there's the whole part of your body. And what people often forget is this is attached to everything else. So we work a lot with other specialists and other parts, but I think you have to have an interest in the health field, in anatomy and things like that. But in my line of work is also we are very textile, so lots of like working with your hands and small instruments and construction. I always joke, like I'm a dentist, yes, but that also means I'm a therapist and a engineer and a MacGyver and an educator and a clinician. I mean, there's so many hats that I wear, just, because there's constantly, everyone walks in the door with some new interesting challenge or something. And for the most part, people walk through our door that are very healthy. So they're they're not the sickest that maybe an RN might see in a burn unit or in something, you know, in ICU. We are generally, people are walking in healthy with some minor disease, you know, focused disease that we can address. But I think, you know, I think that 3D, you know, if you like designing and seeing in 3D, that's, I mean, we do that all the time. A lot of dentistry is going to like 3D milling, and I know that's a big thing right now in a lot of different fields, but we're utilizing it too. Lots of technology stuff. So there's kind of a little bit of everything, but I'd say, you know, liking to work with your hands and also being interested in like the health sciences. So.
Thank you. Mary Kay, what about you for nursing? What kind of interests and skills should one have to jump into that field?
Well, a lot of the skills that Amy mentioned with, you know, attention to detail, depending on what avenue you go in. If you're an OR nurse, you know, handling instruments and things like that, there's different physical traits. But I think the thing that links all nursing professions together is really being able to have strong communication skills and be able to exhibit caring and compassion. Those are really kind of the foundations of nursing. You have to be able to communicate with your patients and families. You have to be able to understand what they're going through, help them get through their pain or their fears. And that's really requires patience. I think it, as Emily says, requires good mental health. It's hard to be there for other people when you're not able to, you know, take care of yourself. And I think, you know, when you look at the pandemic and the pandemic's impact on nursing, that, you know, we've been going at this for a year. That's a long time to be giving everything to everybody and really not having that break to kind of decompress and recharge yourself. So I would just, you know, say the communication, caring, and then also just being able to also take care of yourself are the important skills for nursing, because it can be pretty, it can be hard on you when you're the last person to see somebody or take care of somebody and people are struggling. So you need that good, you need good mental health, definitely.
Thank you. Emily, interests and skills that would be good for a therapy career?
Yeah, I want to name a few, and then I want to go back to something Mary said. I'm going to start with just genuine interest in other people is kind of important. You have to like people. You have to want to understand what's going on with people. And then with that, being able to listen and being willing to learn. You know, we might have these degrees, but it doesn't mean we're experts. I'm not an expert in anyone's life. They're the expert, and I'm just along for the ride. And being able to kind of sit with uncertainty, I think, is really important. You know, we don't have a lot of answers, and, you know, I'm not there to fix anybody. I'm not supposed to. No one's broken, in my opinion. We all just have to figure out how to, you know, put our pieces together and figure out how to move forward in the world, feeling okay. And so just kind of being able to, you know, be supportive of others and wanting to be able to be there. You know, we're all in the helping profession. We all want to support and be there for people. And having empathy for people, having empathy for the situations that they're in, you know, I think is so important. And going back to what Mary was saying, that compassion, that understanding, I think is so crucial. And really what you said, Mary, that really struck me, and I feel is so true, is being able to kind of have boundaries with knowing when to take care of ourselves so that we can kind of pour out into others. You know, we have to have a full cup, or at least have something in our cup to be able to share and take care of others. So in a helping profession, that doesn't mean you help, you know, completely and fully and give everything you have, because then you'll have nothing left to give to yourself or to continue to give. So being able to have good boundaries to take care of yourself, and then so you can continue to, you know, care and have that compassion and empathy for other people.
Yeah, thank you. I think that empathy thing you mentioned is a constant. This is my fourth or fifth, I don't know, health careers discussion or activity that we've done throughout March. And in almost every one, when I ask that question about those skills, empathy is one of the first, no matter what. If you're in the health industry, it means you're kind of taking care of others, and you have to have that care and empathy for others. And it looks like we just got a question that came through from
add, people don't care how much you know until they know how much you care. That's really important, because I have a lot of, in dental school, there's a whole range of people that get into dental school and they had way better grades than I did, but bedside manner maybe was lacking a bit. So it's really important, because, you can learn skills, you can learn the technical stuff, but having that in, compassion and empathy is, that's hard to teach. So I think that's really important.
Yeah. And I want to continue on something that both Emily and Mary Kay mentioned, and this is a question that we have in the chat. Emily and Mary Kay, how do you deal with the emotional distress of your job? How do you find that balance, right, that you were talking about?
I'll go first. It's definitely work in progress. I've been in this career for 30 years, so I've had different approaches. Whether it's just taking time to enjoy your life and your family, whether it's walking or reading, doing things that are comforting to you, I think is important to kind of keep that cup full, as Emily mentioned. And then just from a work standpoint, as I've gotten older, it's really kind of setting limits and boundaries. And that, when my day is over, unless I'm on call or something, then I'm going to stop. Because people will, you'll keep getting requests and stress and things like that if you let it keep happening. And so I think making sure you give yourself that time to say, I'm done and I'll pick this up tomorrow. It's not an emergency, prioritizing things. Those are the things that I do to really try to keep the stress down in the job. And it is hard when it's, people's lives and health and things like that, that can be emotionally taxing. But I think when you think about why you're in that profession and how you're trying to help them, that also helps with your stress, that you're doing the best that you can do to help someone get through a difficult time.
Yeah, I agree. About being able to kind of check in with where you're at and how much you can hold. Without kind of falling apart. I think it's a work in progress. I like the way you said that, Mary. I think it's easy for young people here to think like, oh, they must have it all figured out. They've been doing this. They know what they're doing. Check the box. We know how to take care of ourselves, move on. And it is a constant moving target. And some days you need more and some days you need less. And I think it's important to just be able to notice what you're needing and track if you're needing a little more time for you or for your family, or, how much can I hold today? Because it might be different depending on the day or the minute or the hour. And being able to let yourself turn off when you need to, when it's time. Though that's the boundary piece. I'm going to work until this time, and then after that time, it's for me. Regular self-care. I think people talk a lot about self-care. I think that could be anything that replenishes. For some people, that's trips if you can go on them. For other people, that's just eating food. It can really be the range. And knowing, again, tracking and paying attention to when you need a little bit more on certain days. That's the moving target part.
Thank you both.
Can I add something too? So every time I've done a high school or junior high health career, people are always wondering about like how much you make and all that kind of stuff and what your hours are like. And so I think one of the things that dentistry has done pretty well, because it is a pretty physically demanding job, because you're sitting in the same position doing a lot of micro movements, but most dentists work 4 days a week. So and that has been a functional purpose to save your body and your back and your neck, but also I find it is very recharging just having that extra day to do. I often will do payroll or administrative stuff, but you give a lot of yourself when you're handling other people's problems all day long, right, Emily? And yes, both of you guys. So I think it is a good way to recharge and kind of give yourself some time to step back from the day-to-day grind and take care of other things that also feel like they pile up and get heavy. So yeah, that's one good perk about dentistry is we can kind of design our schedule the way works for us. Or like I have 2 young kids, and so school's in session, now, but Mondays often are holidays, so we don't see patients on Mondays, so I can be more flexible with that. So I think picking a career that meets, that has the flexibility to be able to take care of yourself and make time for other things, because there's lots of other things in the world besides your job. So
yeah, you can't take care of others without yourself being taken care of a little bit first. Yeah.
exactly.
So I want to and then Mary Kay, you're also saying in limited time on social media or watching the news. That's just that's a good tip for any job. That's just a good tip for life. We have a handful of questions that we wanted to get through, but I'm looking at the time and we're not going to be able to get through them all. So what I'm going to ask, I do have an important question to ask, and I'm hoping that we can maybe keep the answers fairly quick, just so we can respect the time of the panelists and the students. But I think this is really important. It's about schooling and training that you'll need in order to get licensed in each one of your fields. And so, Emily, maybe you can start it off. What kind of schooling and training does somebody need to get in order to be a therapist?
So you need, to be able to go to college. So you have to go to college and get your master's, not just your bachelor's, but your master's to be a marriage and family therapist. So that means graduating high school or getting your GED. That means going to, it could be a 4-year at some point, but I started at a junior college and then went to a 4-year, and then went into my master's program, which is roughly between 2 to 3 years for most programs. So it's kind of a long haul, but I know a lot of people, I want to say, first off, that didn't do that all in one span. Most people don't. Sometimes they take breaks. Sometimes they have other careers before they go into the field. So it's a process. And so, yeah, it takes some time. So that's kind of the main part. I hope that answered your question, Brandon. I'm not sure if I should elaborate more.
It did, but you also have a handful of hours that you have to get or
Yes.
go through, right, before you become licensed. You want to talk
Correct.
about that real quick?
Thank you. Yeah. So after your master's program and sometimes during, you do a lot of training. You're a trainee, and then you're also an intern. You do internships. So that's at different sites that you can work at, where you kind of collect your large amount of hours that you have to accumulate before you can actually apply for licensure. And that's to make sure that you actually know what you're doing, that you don't cause any harm in the work that you do, and that you really hone your skill and get used to working in this capacity. So and that takes, let me think, it's roughly 3,000 hours, 1,700 face-to-face direct with clients. So it takes a handful of years to really work through and get to the end. And sometimes you can accumulate some of those hours when you're still in school. Some programs want you to wait until you're finished with school. So it just depends on the program. Some people take, do it really quick. Some people take their time. So.
Yeah, thank you very much. Mary Kay?
Mm-hmm. Nursing, the beauty is you can get an associate's degree and actually start working as a nurse after 2 years at a junior college. So you would need to get your, high school graduation and then go on. And then you obviously could go on and get your bachelor's degree or their other degrees. And then once you become a nurse, you have to, depending on what state you live in, you do have to continue with your continuing education hours. So it's typically 30 hours every couple years that you have to turn in to maintain your license. And then you'd have to pass a licensing test to get your RN degree.
Thank you. Dr. Mansell, you want to round this out?
Yeah, so high school diploma, and then 4 years of college. So getting a degree, mine, like I said, was in kinesiology, which, but, colleagues were business major. I mean, the requirements are that you take certain number of science classes to get admission to dental school, but you could really, your degree could be in anything as long as you have meet the requirements for the science classes and the other ones that they recommend. But and then from once you have your college degree, then dental school is at minimum 4 years. So 4 years to get your doctor of dental surgery, which is the DDS after dentist names. But like I said, there's so many different specialties. So orthodontists might go another 2 years, oral surgeons go another 3 to 4 years, root canal specialists go another 3 years. So it just kind of depends on how far you take it, but it's at minimum of 4 years after college. Yeah.
Thank you all so much. I did get another question. It came through on a direct message, and I'm not sure if that was on purpose to keep the name out, so I won't say who. But I do want to ask this really quickly. This is for you, Emily. I'm hoping that maybe you can answer it pretty quickly so that we can wrap it up here. The person is saying, you know, I know that there is a high demand for therapy right now due to the pandemic, fires, Black Lives Matter movement, et cetera. Do you believe that the demand for mental health professions will continue throughout the years, say, for the next 10 years or so?
That's a really good question. I don't see it going anywhere because thankfully, this career path isn't something that can be replaced by a non-person. Unless technology goes to some really advanced point, which I don't see in the next 10 years potentially. And I don't think that a robot, for example, could be able to have the empathy that we hold. So I think that the need is going to continue to grow. I think as we're seeing now, I think it's just going to kind of continue to be highlighted more of the importance of having mental health support. So I don't think it's going anywhere. I feel like there's some, I'm trying to think of the word, but some good career stability there.
Yeah, for sure. So I think that's a great place to wrap up. Thank you so much to all of our panelists here. I really appreciate you taking your time and sharing your experiences with the students. And Ms. Hine, thank you so much for bringing your students here and sharing this experience with us. So, all right. Thank you, everyone.
Thank you.
Thank you so much.
You. Yeah, of course. Thank you. And thank you to all the students. There were some great questions, so we really appreciate you. Okay. Thanks, everyone.
Thanks.